12 common signs of high cholesterol you cannot ignore. Did you know that cholesterol tends to rise as you age? High cholesterol levels can lead to atherosclerosis, which can eventually cause a major event like a heart attack or stroke. In this video, we'll be going over 12 signs of high cholesterol. Watch until the very end to make sure you don't have it, as this condition can be truly devastating. Number 1. Pain in the legs or feet. Pain or cramping in the legs is another symptom of peripheral artery disease, a condition caused by cholesterol buildup in the arteries of the legs. When blood flow to the muscles is restricted, it can result in pain, cramping, or even a feeling of heaviness in the legs. This pain is often more noticeable during physical activities like walking or climbing stairs, and it may improve with rest. However, as the condition worsens, the pain can become more persistent, even at rest, and the affected areas may begin to feel cold or numb. Peripheral artery disease is a serious condition that can lead to more severe complications, such as ulcers, infections, or even limb amputation, if left untreated. If you experience pain, cramping, or weakness in the legs, especially during activity, it's important to have your cholesterol levels checked. Number 2. Fatigue or shortness of breath. When your arteries become clogged with cholesterol and blood flow is restricted, your heart has to work harder to pump blood to the body's organs and muscles. This can lead to an overall feeling of fatigue, as your body isn't receiving enough oxygen-rich blood to fuel it effectively. Even simple tasks, such as walking or carrying groceries, might leave you feeling unusually exhausted. Additionally, shortness of breath often accompanies this kind of fatigue, especially when engaging in physical activity. As the heart struggles to meet the body's demands, oxygen levels can drop, leaving you breathless. Persistent fatigue, especially when paired with shortness of breath, should never be ignored. It could indicate that your heart is not functioning as efficiently as it should, potentially due to high cholesterol. Number 3. Xanthomas. Xanthomas are small, yellowish bumps that can appear on your skin, particularly around the eyes, elbows, knees, or hands. These lumps occur when cholesterol accumulates in the skin's fatty tissues. While they are generally harmless, they are a direct sign that cholesterol levels may be dangerously high. If you notice unusual yellowish lumps forming on your skin, it's crucial to consult a healthcare provider. Xanthomas often appear as a result of familial hypercholesterolemia, a genetic condition leading to high cholesterol, but they can also develop in individuals with elevated cholesterol from other causes. While the bumps themselves aren't painful, they signal that your cholesterol levels need to be addressed before they cause further health complications. Number 4. Poor circulation. When cholesterol builds up in the arteries, it can limit blood flow to various parts of the body, leading to poor circulation. This is particularly noticeable in your extremities, your hands, feet, and legs. Poor circulation can make your hands or feet feel cold and numb, and you may experience a tingling sensation, often described as pins and needles. Over time, this restricted blood flow can result in muscle cramps, particularly in the legs, and you may notice that it's harder to perform physical activities that once seemed easy. In severe cases, it can lead to conditions like peripheral artery disease, where the blood flow to the legs is reduced to dangerous levels. If you notice cold or numb extremities, or if you experience muscle cramps during physical activity, it could be a sign that high cholesterol is affecting your circulation, and you should seek medical attention. Number 5. Chest pain or discomfort. Chest pain or angina can occur when cholesterol buildup narrows the arteries, reducing the flow of blood and oxygen to the heart. This lack of oxygen makes the heart work harder, and physical activities like walking, climbing stairs, or even stressful situations can trigger discomfort. The pain may feel like a heavy pressure or tightness in the chest, and it may radiate to the left arm, neck, jaw, or back. Angina often signals that the heart isn't getting enough oxygen, and it's a major warning sign of coronary artery disease, which is caused by high cholesterol. If you experience chest pain, particularly with shortness of breath, dizziness, or nausea, seek immediate medical help. These could be early signs of a heart attack, and getting help quickly can save your life. Number 6. Sudden memory loss or cognitive decline. Cholesterol doesn't just affect the heart, it can also impact brain health. When blood flow to the brain is reduced due to clogged arteries, it can impair cognitive functions. You may start noticing subtle signs of memory loss or difficulty concentrating on tasks that once felt easy. If you find yourself forgetting things more often or struggling to focus, It could be a sign that your high cholesterol is affecting your brain's ability to receive the necessary blood and oxygen. Over time, this reduced blood flow can contribute to conditions like dementia or Alzheimer's disease. Cognitive decline caused by cholesterol buildup in the arteries is preventable with early intervention. So if you notice any mental fog, memory lapses, or difficulty concentrating, it's time to check your cholesterol. Number 7. Nausea and vomiting. Nausea and vomiting can sometimes be caused by problems in the digestive system. When cholesterol accumulates in the liver or gallbladder, it can interfere with digestion, leading to symptoms such as nausea, vomiting, and a feeling of fullness. You may feel unwell after eating fatty meals or have a general discomfort in your abdomen. While nausea and vomiting can be caused by many different conditions, persistent or recurring symptoms alongside other signs of high cholesterol should not be ignored. These digestive issues may signal that high cholesterol is affecting your liver or gallbladder, and it's important to consult with a doctor to address the underlying problem before it worsens. Number 8. High blood pressure. High cholesterol and high blood pressure often go together. When cholesterol clogs the arteries, it narrows them and makes it more difficult for blood to flow through. As a result, the heart has to exert more pressure to push blood through these constricted arteries. Over time, this strain increases blood pressure, which, in turn, damages the walls of the arteries. High blood pressure can contribute to further cholesterol buildup, creating a vicious cycle. Often, high blood pressure doesn't show obvious symptoms, but it can cause significant damage to your heart and kidneys over time. Regularly checking your blood pressure is important, especially if you already have high cholesterol, to ensure that both conditions are being properly managed. Number 9. Swelling in the feet, ankles, or legs. Swelling in the feet, ankles, or legs can be caused by poor circulation, a common problem in individuals with high cholesterol. When the arteries become clogged, it becomes harder for the heart to pump blood efficiently, leading to fluid retention in the lower limbs. You might notice your feet and ankles swelling, especially after standing for long periods, and in more severe cases, the legs may feel heavy or stiff. This type of swelling is often accompanied by other symptoms, such as fatigue, shortness of breath, and chest pain. If you experience persistent swelling, particularly in combination with these other symptoms, it's crucial to seek medical advice. Swelling could indicate that your arteries are severely blocked, and you may need intervention to address the cholesterol buildup. Number 10. Frequent heart palpitations. Heart palpitations refer to abnormal heart rhythms, which can cause your heart to race, flutter, or skip beats. When cholesterol clogs the arteries, it can affect the heart's ability to pump blood efficiently, disrupting the normal rhythm of the heart. This can lead to palpitations, which are often accompanied by feelings of dizziness or lightheadedness. Heart palpitations may not always be a sign of a serious condition, but if they occur frequently or are accompanied by other symptoms like shortness of breath, chest pain, or fainting, they can indicate that high cholesterol has begun to affect your heart's function. Left unchecked, it can lead to arrhythmias or more serious heart conditions, so it's important to consult your healthcare provider if you're experiencing palpitations regularly. Number 11. Jaundice. Jaundice occurs when the skin and whites of the eyes turn yellow due to a buildup of bilirubin, a substance produced by the liver. The liver plays a vital role in processing cholesterol, and when excess cholesterol accumulates in the liver, it can interfere with its function. This can lead to jaundice, which may cause your skin and eyes to appear yellowish. While jaundice itself is a symptom, it's often a sign that something more serious is happening in the liver, such as fatty liver disease caused by high cholesterol. If you notice a yellow tint to your skin or eyes, seek medical help immediately, as it could indicate liver dysfunction, and prompt treatment is necessary to prevent further complications. Number 12. Hemorrhoids. Hemorrhoids are often considered a digestive issue, but they can be indirectly linked to high cholesterol. Hemorrhoids develop when blood flow in the rectal veins is compromised, leading to swelling and inflammation. High cholesterol contributes to the thickening and narrowing of blood vessels, which can increase the pressure on veins and lead to hemorrhoid formation. This is especially true in individuals who have poor circulation or vascular health. If you're experiencing frequent or severe hemorrhoids, it may be time to look at the bigger picture of your cardiovascular health. Addressing high cholesterol can help alleviate some of the underlying circulation issues that contribute to hemorrhoids. Don't hesitate to speak with your healthcare provider if you're concerned. Those were the 12 signs of high cholesterol. Did you know that high cholesterol can also contribute to pancreatic cancer? Check out this video to learn about 10 signs of pancreatic cancer. Thanks for watching. See you in the next video.